is Connor Shover. I'm your student physical therapist assistant today. So Mike, I saw that you're coming in with, or you had a stroke a couple months ago, and so you've got drop foot on that left side.
Yes.
Are you familiar with what drop foot is exactly?
No.
All right. So whenever you're walking, I'm assuming you tend to be tripping over your left foot quite a bit. And that's what that drop foot is. It's just the muscles in the front of our shin just not activating enough. And that's just a common side effect from your stroke. So we're gonna do a little bit of treatment today to get those muscles activated and get them strong so you don't have to continuously tripping, or you don't have to continue tripping over your own foot when you're walking. So Mike, I'm just gonna ask you a couple questions. Just give me a little bit of information, and then I'm gonna ask you a list just to make sure that you're viable for treatment, and then we'll be on our way. All right, so Mike, are you currently experiencing any kind of pain in that area on your leg?
No.
And then has this affected, your activities of daily living? Like, do you have any issues washing your hair? Do you have any issues brushing your teeth, cooking for yourself, or just taking care of yourself in general?
Not really.
All right, and then I'm assuming you're not on any kind of medication currently?
No.
All right, fair enough. So I'm gonna run down a list of contraindications, and this is just making sure that you're viable for our treatment. And the treatment that we're gonna be doing today is we're gonna be using electrical stimulation on your muscles to get them to fire. The muscle stimulation you're gonna feel, it's not like you're gonna be sticking a fork into an outlet on a wall. It's gonna be more so like slight pulsing sensation, and then once I start turning it up further, you're gonna feel your muscle tighten, and then your foot's actually gonna raise up off the ground. And then we're gonna apply resistance against that to further strengthen those muscles in the front of the leg. Does that sound like something you're okay with?
Sure.
Perfect. All right, again, I'm gonna run through a list of contras, and just let me know if you have issues with any of these. Have you ever been diagnosed with any kind of cardiac issues, such as like an irregular heartbeat?
No.
All right. Do you have any kind of circulatory issues, such as atherosclerosis, coronary artery disease?
No.
Do you have any issues with high or low blood pressure?
No.
Do you have any sensation loss in that area of the leg?
No.
Do you have any kind of personal history of cancer?
No.
Have you had any kind of recent illnesses or injuries or any kind of temperature raises of any sort?
No.
Have you ever been diagnosed with osteoporosis, osteopenia?
No.
Do you have any kind of metal or implanted devices, so such as like a pacemaker or anything of the sort? Do you have any metal placed in that knee?
No, I do not.
All right. And then, do you have any kind of allergies to any kind of topicals, like any gels, ointments, anything like that?
No.
And then, do you have any kind of ointments on that area?
I do not.
Perfect. All right, it looks like you're all good for treatment. So we're gonna go ahead and get into it. So all I'm gonna do is apply the pads here. So I already found the spots earlier, just so the video wouldn't take 45 minutes. I marked the spots here and here, so I'm gonna go ahead and apply the pads. Here, move this up slightly. Get a little bit of water on them. Let's go here. turn on the machine. All right, so bring the camera up a little bit closer. So typical treatment time, we're just gonna toss on for 20 minutes, just because we are gonna push until fatigue. So just 20 minutes should be enough time for him to reach fatigue. We're gonna be in electrical muscle stimulation mode, and then we're also gonna be in synchronous mode, just because we are activating that one muscle group. For settings, this kind of changed on me. All right, so time, 20 minutes. We're gonna change the pulse width. It should anywhere between 200 and 400, but we found this was best for comfortability for him, and we were still able to get correct pulse. So we're staying at 140 pulse width. And then because the anterior tib is a little bit of a smaller muscle, the dorsiflexor is a little bit of a smaller muscle, we're gonna stay in 20 hertz for that muscle activation. For ramp time, it's just gonna be 2 seconds because I was not notified of any kind of spasticity or flaccidity with this patient. So 2-second ramp time should be fine. And then because we are doing muscle strengthening, we're gonna be going 4 seconds on and 12 seconds off, which is a 1-to-3 ratio for strengthening. All right, so I'm gonna go ahead and turn up the stim. Mike, like I was saying, you should be feeling just a little bit of tingling first, and then it's gonna get a little bit more intense, it's gonna be a little bit uncomfortable, but we're gonna find the spot to where your foot goes all the way up, and then it's gonna drop, and then whenever you feel that stimulation whenever you feel that stimulation come on again, I want you to raise your foot up with the stim, and then slowly bring it back down whenever the stim is turning off, okay?
Mm-hmm.
So I'm just gonna turn it up. Yeah, so you can just relax for now, you don't have to do anything. Okay, it looks like we found the spot. All right, so Mike, whenever that stim gets turned on, I just want you to raise your toes all the way up with that stim, okay?
Okay.
So I'm gonna apply resistance and then just push into my hands whenever that stim attacks. Or activates, I should say. Push up against me. It's gonna be on for 4 seconds, and then slowly bring your foot down. And we're just gonna go until fatigue. And bring your foot all the way up to the sky. Up, 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 up. And slowly back down. That's number 2. And raise that foot with that stim all the way up. There you go. Slowly bring it back down. And work with that stem, bring that foot all the way up to the sky, up, 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 up. And slowly work it back down. Getting tired yet?
Sort of.
All right, let's go ahead and try for one more. Make sure you're working with that stem whenever it kicks on. Raise that foot all the way to the sky, up, 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 up. And slowly back down. All right, good job. All right, so Mike, that was our treatment for today. Turn this off here. Slowly bring that foot down. All right, perfect, good job. All right, so yeah, that's pretty much what our treatment is going to consist of. We're going to continue this treatment to further strengthen that anterior tib, just to make sure that you can raise that foot whenever you're walking, just so you don't have to keep tripping over yourself. Do you have any questions before you head out?
No.
All right, perfect, Mike. Thanks for letting me work on you. I guess I'll see you next time.